All right. So I am Amy Williams, AMYWILLIAMS, and I am the Executive Dean of Practice for Mayo Clinic. And that means I oversee and am responsible for patient care throughout Mayo Clinic at all of our sites. So thanks for joining me again this afternoon. Today, I'm really going to focus on how we are fighting the pandemic and that we just cannot let our guard down. We have to stay focused on fighting this pandemic, every single one of us doing this together. So let's start with some numbers, and then we'll have a conversation afterwards. So we've seen the number of positive COVID-19 tests in the Midwest actually decrease, which is very good. We saw a decline yesterday to 302 positive tests, but unfortunately today, we saw it bounce back up to 381. Now, this is still lower than we have seen in the past, especially during this surge. But what this tells us is that COVID is still in our communities, and we still need to stay safe. We have also seen our percent positivity rate start to stabilize or go down across our region, everywhere but in Southwest Wisconsin, where we saw over the weekend that their positivity rate just soared. And we're watching this very, very closely because we are afraid that we're going to see this end up with increase or cause increased hospitalizations for those in that region. So something we need to continue to watch very, very closely. We also know that with the decrease in the percent positivity rate, remember our goal is to be less than 10% and really less than 5%. 1% would be wonderful. When it's higher than that, we know that we are all at increased risk of getting this infection from the community. So masking, social distancing, and robust hand hygiene and avoiding any circumstances where you can't do this reliably is so important to maintaining or continuing to see a decrease in the number of COVID infections that we have. So this is all very, very good news everywhere but Southwest Wisconsin right now, and we're watching this very closely and hoping that they will be able to start to see a decrease in their positivity rates. So what about staffing? We've talked for a number of weeks about the impact of COVID-19 spread in our communities and the impact on our staff. Well, we've also seen a decrease in the percentage of our staff that are out due to COVID-19 related issues. It's now down to 2%, which is spectacular because we know that we need staff in order to care for the individuals that are currently in our hospitals with COVID-19 and without COVID-19, and those individuals in the outpatient setting who we need to care for, both with COVID-19 and without COVID-19. So protecting our staff is very important, and the way to do that is mask, social distance, and robust hand hygiene. So what about the patients? How many patients do we have in our hospitals? Well, today, we started out the day with 181 COVID-19 positive individuals hospitalized across our Midwest hospital system. This is down from 217 yesterday and way down from 300 that we had last week when we were doing this briefing. So again, decreased hospitalizations, decreased percent positivity rates, all of this is a good sign. And it shows that the measures that have been put into place are working. But we can't let our guard up, or can't let our guard down, excuse me. We just can't. COVID is still in our communities, and we need to do everything that we can as individuals to protect ourselves and to protect others. And that's masking, hand hygiene, and social distancing. So what about that Thanksgiving surge that we were talking about? Well, the fact that the number of positive or new cases of COVID-19 increased from yesterday to today has me a little bit nervous, because we're right at that time when people who were exposed over the Thanksgiving holiday would start to get symptoms and need to be tested. So please, If you were at any function over Thanksgiving, any gathering where somebody has ended up being positive or developed symptoms that could be COVID-19, please get tested. Please wear a mask to protect others until you find out if that test is positive or not. And even if it is negative, which would be wonderful, still wear that mask because you don't want to get the virus. All right, so what about the number of individuals that we have in each of our hospitals? I don't think I'm going to go through all those numbers today. We still have hospitals that are stretched in capacity, and it depends on the site. In Rochester, there are 83 individuals with COVID-19 in our hospital, with 21 in the ICU. In Northwest Wisconsin, another big site, they have 50 individuals with COVID-19 and 7 in the ICU. And in Southwest Minnesota, 34 patients with COVID-19 in the hospital and 5 in the ICU. Now, I said I wasn't going to go through these numbers, but those are the hospitals where we're seeing still a significant number of patients with COVID-19. Our other hospitals are in Southeast Minnesota. We have 17 patients with COVID-19 and 4 in the ICU. And in Southwest Wisconsin, we have 14 patients with 4 in the ICU. So still a heck of a lot of COVID-19 out there and a lot of individuals needing to be hospitalized. We have dismissed 3,722 individuals who were admitted to our hospitals with COVID-19. That's a lot of people who have had COVID-19 and luckily have recovered. What are the different things that we have to treat COVID-19? We talked about this last week. I'm going to talk about it again because they are so important. Monoclonal antibodies, number one. We have infused 577 patients so far, individuals so far, with monoclonal antibodies. And the idea behind this is that you get this therapy early in the course of the disease when you first test positive or when you first start to develop symptoms. That decreases the severity of the disease and helps prevent the need for hospitalization. This is so important, especially for individuals who are vulnerable, and that's anybody over the age of 65. And if you add on to that individuals that may have underlying health conditions, the vulnerability or the risk of having a bad outcome from COVID-19 goes up. And in fact, we are so convinced that this is helping our communities, that there was a nursing home in our community here in the Midwest that had 12 individuals with COVID-19, had tested positive with COVID-19. And so our team thought, they can't get to us, we've got to get to them, or they may end up in our hospitals. So they put a mobile team together, went to the nursing home, and infused 12 individuals at the nursing home. This is what it's all about. It's helping our communities. It's helping each other fight this pandemic and to have the best outcomes possible. Of course, the other thing that we are doing is trying to educate everybody about this therapy. Many people are concerned about it. They don't want it, or they're refusing to have it because they say, oh, I don't have symptoms yet, or bad symptoms. Give it to someone who's sicker. But it's important to get it early in the disease. It does not depend on liver function. It does not depend on kidney function. It does not impact any medications that you're already taking. So please, if you test positive for COVID-19, call your primary care provider and ask about this infusion. The other thing that we have, of course, is the antiviral remdesivir that needs to be started in the hospital, but you get 5 infusions of it, and we can give all but the first one in the outpatient setting. So that's actually decreasing the length of stay of individuals who are admitted to the hospital and get remdesivir. So this is all good. The next step is, of course, the vaccine, which Governor Walz talked about this afternoon. We are ready. We are ready to distribute that vaccine as soon as they can get it to us. We have identified throughout our system in the Midwest and in Arizona and Florida where we're going to distribute the vaccine, what staff will be distributing it, and we will be abiding by the state rules as far as the tier of individuals who will be getting the vaccine. And the first blush of this will be individuals that are healthcare workers or are living in long-term care facilities, and also those who are most vulnerable in our communities based on disproportionate COVID activity in those communities. So we will be abiding by the state rules, and we know that we will be getting enough of this vaccine that over the next couple of months, we will be able to vaccinate our staff, our community, and we are very, very excited about this. I want to also remind all of you that many people are worried about getting the vaccine. So we are deliberately educating as many people as we can and in as many ways as we can so that every individual can make the right decision for them whether or not to get the vaccine. And certainly talk to your primary care providers, your docs, your care teams about the vaccine. What about our elective care? This has been a big discussion throughout the surge in this pandemic and throughout the pandemic. Well, we are doing elective care. We did decrease our elective inpatient surgeries that would need the patient to have an ICU bed after surgery. But we are seeing, if we can continue to see this trend, we will be able to open up all surgeries. Right now, those are the only ones, elective surgeries, that the individual would need an ICU bed after surgery. That is the only elective care at all that we are limiting or delaying. Our outpatient clinics are open, and we are ready to care for anybody who has COVID or who has symptoms that are not COVID but they need medical attention. And with that, I think I will turn it over for questions and any gaps that I didn't fill for you. I'll be glad to do that during the question and answer session.
Great, thanks, Dr. Williams. So a quick note on the vaccine information. So tomorrow from noon to 1 Central, we do have a deep dive media briefing availability with Drs. Verk and Swift on vaccines. You can ask anything you want. If you have not received the invitation for that, do send me an email, newsbureau@mayo.edu, and we can get that to you. And that's tomorrow at noon. So first question here is from Beth Cornish. Were the clinics that closed in Belle Plaine and Le Sueur closed to allow healthcare professionals to work in the hospital?
Yes, that's exactly why they were closed, in order to shift that workforce to the hospital and to care for other COVID-19 needs, such as monitoring patients in the outpatient setting who are not yet admitted to the hospital, and to make sure that if they do start to decline in their health status, that we can be right there to help them and either prevent that hospitalization or get them to the hospital before they get even more sick. So that's exactly why these are temporary closures. The other community clinics that are nearby are open to see patients and are safe.
All right, thank you. This is from Chris Snowbeck. If the number of positive tests between Monday and Tuesday increased from 302 to 381, what was the volume of test result issued on each of those days? Could the higher volume today stem from a higher volume of tests? And if you don't have that, I can look into that for him.
I don't have those statistics at the top of my brain at this moment, but you're right. We did see an increase in testing. Usually over the weekend it drops off a bit, but then during the week we see it rise at the beginning of the week. So we're watching this very closely. We are worried though that we're going to see a little bit of bump from that post-Thanksgiving mini surge that most likely we will see. It will be great if we don't, because that means everybody stays safe. And I do want to say that if you did attend Thanksgiving gatherings and nobody got COVID-19, that is spectacular and really lucky based on the percent positivity in our communities. So don't count on being lucky again as we continue through this holiday season, and still think very carefully about gatherings and staying safe and who the most vulnerable people are that you don't want to put into circumstances that are risky for them. So again, I'm glad if you didn't get COVID-19 during a holiday or Thanksgiving holiday event, but that was lucky based on our percent positivity. And please be safe over the rest of the holiday season.
All right, great, thank you. This comes from Andrea. Is Mayo mandating that staff be vaccinated once an approved COVID vaccine is available and delivered, or is it voluntary?
It's voluntary. This is an emergency use scenario. And so these are not yet FDA approved. Now, hopefully we will see that very, very soon, but it's still under emergency use. So absolutely, it is voluntary.
All right.
But we still hope that people get this vaccine.
All right, sounds good. All right, so this clarification question from Chris Snowbeck. Did I hear Dr. Williams say that given the improved trends with the volume of COVID patients in the hospitals, Mayo might soon resume all non-emergency procedures, and at which at this point means those that could result in ICU admission?
No. So right now we are, well, as you stated that, it is correct, but let me restate it. At this point, we are still postponing those inpatient surgeries that are elective and can be postponed if the patient would need an intensive care unit management or bed after or in the perioperative time frame. If we see continued decrease in the number of individuals who need ICU care in our regions, then we can open up even those surgeries.
All right, thank you. This question sent to me privately, would love to hear more about why hospitalizations are going down. Does it feel like a stable trend due to some of these public health interventions, or is this still tenuous because cases remain so high?
Yeah, I'm very hopeful that that we're going to see at least things level off at this level. Prior to this, the last 2 days, prior to that, we have not seen less than 90 COVID positive patients in our hospital in Rochester. The last 2 days, we've had 87 and now 83. What we have seen is the length of stay for these individuals has gone down. So that's good news. So they get out of the hospital faster. Part's remdesivir. The other is that we really understand how to manage these individuals. And they might be coming or seeking help earlier. The other thing that we have seen is that with the monoclonal antibodies, we are seeing fewer and fewer individuals need to be hospitalized, which is exactly why we're giving it, decreasing the severity of the disease. I do think that people have been paying a lot of attention to the need to mask and social distance, etc. And that has definitely helped decrease the number of individuals that end up in the hospital, the number of individuals that test positive. So yes, I think it's a combination of things. And I hope the trend continues. The trend has been for 2 days. So I'm hoping that we see it at least level at this point and continue to improve.
So a little early to declare victory. Right. Okay, and then just a clarification question from Evan. So you are still expecting a post-Thanksgiving surge to come, or are you feeling you're in the clear?
So our modeling shows that we should be seeing a post-Thanksgiving surge. This coming week will really define if we're going to see it. So our fingers are crossed. We haven't seen it yet, and we're right in that time frame where we should be seeing it. So we're watching very closely, and this is another reason why we are still limiting those specific elective surgeries that require ICU care afterwards.
All right, thanks. This one was emailed to me from Bob Gallagher, WEAU TV. Wondering if you could share your thoughts on the wearing of masks during high school basketball, hockey, and wrestling games. Is it effective?
Yes, it would be effective. First of all, it's effective for everybody in the stands. Second of all, we know that from studies, we know that wearing masks will decrease the aerosolized and droplets leaving the source, leaving anybody. So if you have COVID-19, it is really important for you to have that mask on, because that will help prevent those droplets and the aerosolized particles from going to somebody else. If you don't have COVID-19, it will protect from that. Now, unfortunately, when somebody is exercising, you could generate aerosols as opposed to the heavier droplets. So in that circumstance, you would need certain types of masks, and that may be difficult during sporting events. And the other thing is that if there's aerosolization, you would also need some eye gear to protect your eyes.
And to combine that with social distancing.
Combine it with social distancing,
right,
which is hard during hockey and basketball and all the other sports.
Got it. Okay. All right. So I don't have any additional questions coming in. So journalists, I would invite you, if you wish to just unmute yourselves and ask a question directly, feel free to do so.
Oh, hi. It's Chris in Minneapolis. I had a quick question on the monoclonal antibodies. So, I mean, I sort of heard you say, I think, that there may be some connection to the improved hospital volume and usage of the antibodies. Is that right?
That is correct. So in around a little over, when we did our first 100 and 100 plus individuals, or did infused monoclonal antibodies and treated around 110 or so individuals, we found that only one of those individuals needed to be hospitalized. And if I recall, it was not COVID-related hospitalization. And normally we would see 10 to 12% of individuals in this risk group needing to be hospitalized. So we thought that was a wonderful, wonderful sign that this is going to be effective. And we're waiting, now that we've done 577 as of the end of yesterday, I don't know how many today yet, we are going to be looking at that again to see if that did decrease, what percentage of hospitalizations were decreased in that cohort.
Gotcha. Real quick follow-up, that 100 or so, I assume they were treated early enough where they're kind of outside of the window where there might be a COVID hospitalization. Is that right?
So right, everybody, they only qualify for the treatment if it's within 10 days of being diagnosed or 10 days of symptoms. So they all have to meet that first criteria. Once they're past that, we don't see evidence from previous studies that they would have the benefit from the monoclonal proteins, and that's what monoclonal antibodies, and that's why it's so important for people to get it early in the course of the disease.
Okay, thanks.
Any others? This one did come in on the chat from someone who couldn't be on but is getting the recording. Can you spread COVID-19 if you get a vaccine?
You can't spread it from the vaccine, but if you have it or you acquire it after you get the vaccine, because we don't quite know how long it takes to actually develop immunity from the vaccine. And remember, you need 2 doses with both vaccines. You need the initial dose, and then you need a second dose, either 21 days or 28 days after the first dose. So during that time, certainly you're not totally immune. And we don't know how long it takes to develop the immunity that you need to fight the disease. But if you already have the virus or you get the virus, you could still shed the virus, even after you get the vaccine.
All right, thank you. Any others? We're just about at time, but if anybody wants to unmute themselves and ask a question, please do so. Okay, last call for questions. Anything else you want to say, Dr. Williams? Parting shots?
The only thing I want to say is I want to thank all of you for getting the news out there and getting the information and the data that our communities need in order to make the right decisions for them and to stay safe. All of you, please stay safe. Mask, hygiene, hand hygiene, and social distancing, so important, so important.
All right, well, thank you everybody for attending. And if you do need a recording or any other follow-up questions, email newsbureau@mayo.edu. I will recap the numbers that were shared today and send those via email to the email you used when you registered. And I think that's all we have for you. Thank you so much. Thanks, Dr. Williams, for your time as always.
Thank you, everybody. Have a good day.
Bye-bye.